A country desperate to speed up its vaccinations is being forced to slow down.
Pfizer has confirmed that Canada's deliveries will be impacted for the next 4 weeks. We will see an average reduction over this time frame of 50% of expected deliveries.
Those temporary reductions, the result of work to expand production at this Pfizer plant in Belgium. Long term, it means a boost in global supply. Short term, it means Canada and the European Union will get shipments that are hundreds of thousands of doses light.
It is going to be temporary. It's not a loss, and we will make up those doses.
I understand the disappointment today. I share the disappointment.
Pfizer deliveries are slowing down as the rate of infection is speeding up, moving further and faster across the country, seemingly fueled by holiday gatherings.
Many provinces, including those that had been on a downward trajectory, like BC, Alberta, and Saskatchewan, saw a sharp rise in daily case numbers after the holidays.
That increased community spread poses a direct threat to those most vulnerable Canadians, already in line to get these now delayed vaccines. In the first wave, COVID reaped a path of sorrow through long-term care homes. The outbreaks in the second wave now exceed the first.
There have been an increased number of outbreaks in long-term care facilities, ranging in size from a few cases to over 100. This is a difficult cycle of spread.
The interruption of the vaccine supply is a clear setback, but it should be temporary. When the Belgium plant is back online, Canada should get back on track.
I want to be very clear. This does not impact our goal to have enough vaccines available by September for every Canadian who wants one.
Hey, David, what does this mean for the goal of vaccinating 3 million Canadians by the end of March?
Yeah, the government still thinks they can hit that target, Ian, but this obviously slows it down. The expectation is that they'll still get all 4 million doses from Pfizer by the end of March, but this means that delivery schedule is now going to have to be much more heavily backloaded.
And Pfizer has a facility in the United States, and so why can't we get doses from there?
Yeah, so Canada's contract with Pfizer is to get its doses from the European facility, and at first that seemed like a really smart idea because it got you around Donald Trump and all of the uncertainty of what he might do if you tried to take vaccines out of his country. But now you find yourself in a situation where the European production is down, you have no access to the US doses because they're all already spoken for, and there's no extra doses to be had. And it doesn't, at this point, Ian, look like there's any extra Moderna doses available on the market, so it all just means Canada it's going to have to wait.
David Cochrane, thank you.
You're welcome.